Good morning and afternoon to everyone. Welcome to this very special IAS-USA course on PrEP. And this is we usually do this course in DC, but because of COVID, we're doing it virtually. But that gives us an opportunity to have this course go worldwide. And you'll see in a second that we are all over the world. And we're dedicating today's course to Dr. Scott Hammer, who passed away this week, and we'll talk about him in just a second. I'm very pleased to co-chair this course with a good friend and colleague, Dr. Henry Masur from the George Washington University, and he also, as you all know, has been working at NIH for several decades and as a world leader in HIV and therapies for especially lung disease, but all the opportunistic infections. Next slide. So Scott Hammer, many of us knew and worked with Scott Hammer. Everyone who ever interacted with him loved him. It goes to show that to be successful in academic medicine, you can be a really nice guy and still get the work done. He was the kindest person I've ever worked with in academic medicine. Always helpful, always smiling, always trying to promote the people around him, especially if you were his mentee. You can read along with me here on the left, but he had such a legacy of outstanding work. A lot of you know his work that he did in the ACTG, especially in the early days with triple drug therapy. But later he worked a lot in vaccines and trying to develop an HIV vaccine. And a lot of that work actually helped pave the way for the type of clinical trials that led to the COVID vaccines being produced so quickly. He was very, very involved in the IAS-USA in its work. He was on the initial panel for the IAS-USA guidelines on antiretroviral therapy in 1996 and co-chaired, or actually chaired, the guidelines in 2006 and 2008, always a great contributor. As it says here, a brilliant scientist, compassionate physician, extraordinarily generous and caring friend, one of the most humble individuals you'll ever would meet. And I think this picture there of him is so appropriate, not only because you sort of feel his empathy just in the picture, but for those of us who really knew him, this was his uniform. This is his jacket that he wore most often, the same type of tie and shirt. So we really are saddened by his loss and honor his memory by dedicating this course to him. Next slide. So this course is, of course, CME driven. We have 4 AMA Category 1 credits, and it's sponsored by the IAS-USA, which is responsible for all the content and providing the CME credits. Next slide. The CME extends beyond physicians. For physicians, you can get ABIM maintenance of certification points, but also for nurses, nurse practitioners, get contact hours. For pharmacists, you get pharmacotherapy contact credit, as well as pharmacy contact hours, which is frame shifted off by a decimal point. Next slide. This whole series of webinars and meetings is made possible by unrestricted educational grants from these companies that you see listed here: Gilead, Merck, ViiV, Janssen, and Theratechnologies. What's really important to note is that these dollars are given in a way that is totally unrestricted. There's no input at all in terms of content or the types of course or the topics or the speakers. This is all up to the IAS-USA and to the directors of each individual course. Next slide. So, despite the disappointment of not being able to gather together at the National Press Club in Washington, we are now able, though, to do this course virtually. And we have attendees from all over the United States and Puerto Rico, but we also have international colleagues joining us from Canada, Denmark, Ireland, Italy, Mexico, Singapore, the Virgin Islands, and I just saw Lima, Peru. So welcome. And I can't tell you how exciting that is. We also are looking here at the poll results that came out. So most folks listening in, about almost half are physicians, but we also have a wide range of other colleagues who are here with us. And then as far as PrEP use, about, again, half the audience so far hasn't really prescribed PrEP. So this is a great course for you. But there's also people who have done this quite a bit, and this is also geared for you. And one of the things that is special, and why, when Dr. Masur and the team at IAS-USA were putting this course together, we had a series of webinars on HIV of all sort of stripes, and when to start antiretroviral therapy, what to use. And we had usually at least one lecture on PrEP, but we thought, since this was really DC-centric initially, that we would focus on PrEP in a way that not only brings us to the state of the art and puts us into the context of how this tool, PrEP, can be used to help us in the HIV epidemic. We also realized that this was a great way to get into policy, and that will include discussion of cost and distribution and how to gain access, overcome barriers. So the entire day is dedicated to PrEP, and I'm not sure that there's been another CME type event that had this focus. There may be. I didn't do research on it, but I know, at least in my experience, this hasn't been done before. So we're really excited about this. It's always a great pleasure to host anything with Dr. Masur. And so being back with him and being with all of you is a great joy. Next slide. We have, on the next slide, we had a practice test. Didn't do so well, but that's the point. All the questions that were in that assessment are things that we're going to cover during the course. So we expect that this will go from a 23% pass rate to well over 99 or 98%. So be listening. Your questions, the questions that were asked, will be answered as we go through, and I'm sure we'll see a dramatic change in this score at the end of the course. Next. Now, since we're on Zoom, instead of passing notes to one another if you were in a live room, you can actually chat, and people have already been doing that. Welcome. I love the fact that people are telling us where they're from. The chat box is open to all the attendees. If you're thinking of something or want to make a comment, knock yourself out, put it in there, and you can have this back and forth among the audience, which I think is a very dynamic feature of Zoom, and we're happy to provide that. But if you have a question for any of the presenters or later in the day for the panelists, that has to go in the Q&A box. So if you look at the bottom of your screen there, you'll see chat, and a lot of you have already used that, but off to the far right, at least on my screen, in that same line, there's Q&A. That's where you put your questions. If you put your questions in the chat box, there's a pretty good chance we're going to miss it in the action, because we're going to be looking to the Q&A box. So chat away as much as you want, but when you have a question, put it in the chat box, please, and then we'll be able to get to it. And if we don't get to every question asked as part of the verbal interchange with the panelists or with the speakers, the speakers have agreed to go in and type in answers for you. So we'll get to everything before this is all over. It's another advantage of doing this virtually as opposed to in person, where we oftentimes don't get to every question. Next slide. The presentation slides, this is meant to be educational at the moment, but also for you to have slides that if you want to take what you've learned today and share it with colleagues, give your own talk locally to your clinic or to your group, great. The slides will be made available to you following the course through the IAS-USA website. Next. So here's our agenda. We're going to go over the state of the science with Rafi Landovitz. Then we're going to go to France. Another advantage, we can have international presenters, and Jean-Michel Molina is going to talk to us about new strategies for PrEP, which will include new formulations of drugs. Then we have Hyman Scott from California, who's going to talk to us about how do you assess and monitor. That includes not only for the safety of the PrEP, but also for STI. We'll take a little break. People can get lunch or stretch their legs, And we'll come back with a wonderful talk by Susan Buckbinder, who's an epidemiologist, and she's going to put this all into the context of why this is important and what are the populations that are hard to reach and who we should be focused on, especially when there are barriers. We'll go right from there into Monica Gandhi, who's going to talk to us about how to reach the hard to reach populations and strategies for that, overcoming those barriers. And then, true to the mission of what we talked about for this course, Jeff Crowley, who is a former White House HIV czar during the Obama administration, is going to talk to us about how to interface with administrative and government policies to improve the utilization. So it'll be a little bit U.S. centric, but I think a lot of those things will translate internationally. And in the expert roundtable at the end, we have invited Marina Klein, who from Montreal, who will bring into this an international perspective with a different health system, obviously, that's more of a government-based program, which applies to a lot of you listening in from overseas and from our neighboring states, our countries of Mexico and Canada. So that's our day. Pretty excited about it. Here's our incredible cast of presenters and speakers, world class, truly. And so I think we'll get started right away.